Now, this particular lady is taking cartesian, I understand, for some time. Now, as per our academies of orthopedic surgeon in the US, cartesian foot and hyaluronic acid, which are act as viscose supplements, as such they have not shown any benefit on the long run for any arthritis of the knee.
Correct.
The thing that is likely to help her more is a bit of physiotherapy and weight loss. Now, having said that, weight loss is one of the most difficult things in the world, and the whole industry is based on that, right? So, that is something.
But we don't know what is her weight.
Yeah,
because we are not asked.
You should not ask a lady's weight.
Oh, good. They're always lightweight.
Yeah.
Okay. So, yeah. So, definitely the thing can be managed if properly assessed, and the cause has to be, root cause has to be established.
Yeah.
So, and one more, what I can just conclude is that though this, we are not naming any medicine, but lot of medicines are being prescribed and taken by patients also, maybe whatever placebo effect or whatever you can say, but they have limited role, because this is another, in fact, we are hearing for the second time that such medicine have limited roles. I am not saying totally no role, but a limited role, but perhaps if now after listening to this conversation, if her mindset is properly organized, I am sure that she will feel better even without medicines.
Yeah, definitely.
Okay. Chalo, let's take the next call. Hello.
Hello.
Yeah.
Hello, doctor.
Bye.
Maria Fernandez.
विचार.
ऐकून येता?
अरे मोठ्यान उलयला ऐकूंक येतले नाही, तू सावकाश उलयता, मोठ्यान उलय. विचार मारिया.
दोतोर 40 वर्सांचो पेशंट आहे, 40 वर्सां आहे.
ए तुझ्या घराकडे टीव्हीचा आवाज कमी कर, मारिया तुझ्या घराकडे टीव्हीचा आवाज कमी कर.
तेका दोतरेपण एक मातशें तेगे दिमी हाल्लोली, मागे एक दोतोरा दाखयला, तो दोतोर म्हणून आलो तो लिगामेंट तुटला आनी तेका बेगीन सर्जरी करून पडटली, पूण करूं ना. आम तेगे 7 वर्सां जालीं. मागीर तो आनी एक दोतोरा बोले गेल्लो आनी तेणें तेका कार्टिजीन फॉर्ती घेवपा लायली. तेज्यान तेगे मातशें आहा बरें आहा, पूण थोडे दीस बंद करीत जाल्यार तेका दुखता. दुसरो प्रश्न म्हळ्यार आतां सगळे भुरगे आसतना दिम्यो हाडां दुखताय आनी तें जायना जावपाक, तें कॅर घेवपा जाय जेवण खाणाचें.
बरोबर. येस, थँक्यू मारिया, थँक्यू. तुजो प्रश्न कळ्ळो.
सांग म्हाका.
येस, तुजो प्रश्न कळ्ळो. तोच हांव तांकां विचारतालो, पण आमकां प्रश्न लायनीर आशिल्ले. एनीवे, थँक्यू फॉर आस्किंग गुड क्वेश्चन. आतां तुवें सांगलां न्हय, वन ऑफ हर पेशंट हॅज इज 40 years. He had some ligament tear problem, but for last 7 years he is taking off and on that one of the medicine, as you have mentioned earlier, and he feels comfortable. So her question of whether she can continue or he can continue for a long time. Otherwise, if he doesn't take medicine, as the earlier question, pain persists. So we can definitely relate and say, okay, medicines are giving good result. Chalo, this is first thing. And secondly, what she was asking the same question, like these are the days a lot of young people are having a lot of bone problems, like they cannot sit properly, they get all this. So what your lifestyle disease, she wants you to address that. And what should be habits, what food, and what postures to be adopted?
Yeah. Hi, good evening. Regarding your first question, at 40 years, probably the gentleman had a
he had some
ligament injury. Yeah. Now, as for the medicines I discussed previously, they don't have any side effects as such. Yeah. So, if they make you feel better, of course, you can continue with them.
Correct.
How long? I mean, how good are they going to give you a good result in the long term? That is doubtful. Yeah. So, that is what our academy has written. You know that the long term results and the benefits are not there. Are doubtful. Yeah. But there are no side effects as such. So, if it makes you feel better, definitely you can continue with it. But the only thing I will suggest is, see, in my clinical experience, I have seen, problems of the joint that are addressed early. Okay. Suppose there is a degree of arthritis or a ligament imbalance in the knee or whatever it is. If it is addressed early with minimal management, you can get away with it with proper management. So, if a ligament problem is there, we give good physiotherapy, or with physiotherapy the knee movement improves, then your cartilage will not get damaged further. Okay. If we do not manage it properly with physiotherapy or probably arthroscopy in the early stages, what will happen is the damage will continue to be there. Okay. See, arthroscopy surgery or any ligament reconstruction is something to give you a more active lifestyle. Right. So, what will happen is a knee which will last for maybe 70 years or 80 years, if the movement in that is, not regular, the arthritis will set in early.
Correct.
So that is what, it is about joint preservation.
Yes.
So that's the whole concept.
Yeah.
Now, as far as lifestyle is concerned.
In a nutshell, because now we have got another question on
Yeah, sure. So as far as lifestyle is concerned, the thing that I see a lot nowadays is people having junk food.
Correct.
Okay. Now, I don't want to name any outlets as such,
yes,
because I myself go to those outlets.
At times.
At times, not regularly.
They will say the doctor is also going.
Yeah, at times, not regularly. So, we have to keep the junk food, at a limit. Our Indian food is very nutritious, and if we take that, that is very good for the health. So, what I would suggest is, try to keep your weight at the optimum level. Try to avoid a lot of fatty things. The best way to lose weight for people who have a bit of, plump is to, have small meals, have it, 4 or 5 times a day rather than, having a binge of a big dinner or a big lunch like that. That is something I would advise. As far as people with arthritis is concerned, knee arthritis that is concerned, I would advise them, you have to continue with the normal activities, okay? That if that involves walking for a distance, that is good for your knee, okay? So,
okay, sure. I think again, as and when we'll carry on, because our people cannot hold for a long time.
Sure.
Hello.
Hello.
Yeah.
Doctor, how are you doing?
विचार.
माझं डॉक्टर राईट शोल्डर सुट्टा 4-5दा सुटला माझा तो. आणि बसयलो आणि रातची चड दूख जाता.
अच्छा, मग तो बसयता तू.
हॉस्पिटलात बसून घेतलो दूख जाता.
तू डॉक्टराकडे वचून बसयता का आपल्या आपण बसयता?
ना, डॉक्टराकडे बसयला, 2-3 हॉस्पिटलांनी बसयला आणि जाप करून सुट्टा तो.
अच्छा.
माझी एज 27.
ओ, यंग.
ऑपरेशन केला बरं.
नाही ऐकून, पण सुरुवाती कसं सुटलो? एनी ऍक्सिडेंट?
माझे क्रिकेटीक लागून सुटलेलो, क्रिकेटीक सुटलेलो तो.
ओके ओके, कळलं.
4-6 वर्षा आली.
बरं, ओके. दिस जेंटलमॅन, young person, and he is having shoulder dislocation so frequently, and then it has to be restructured. So he wants to know whether whether the operation can give a lasting effect. I mean, can be the solution for this problem.
Yeah. Firstly, good evening. See, from what you have told me, you are having this problem of recurrent dislocation. That is, your shoulder is coming out and out again. That is a very common problem in athletes and in general in young people. Okay. So that is something we need to address. What happens is, if the shoulder keeps on coming out very frequently, there are tissues, as I said, surrounding the shoulder. They keep on getting damaged repeatedly. So the earlier we treat it, the better it is. Okay. In addition to that, if it keeps on coming frequently, early, you get arthritis. Okay. So this kind of arthritis is the worst form of arthritis, which sets in at 35-40 years of age.
I see.
So the earlier the treatment, better it is. Nowadays, with arthroscopy, we have new modalities in which we can treat this. So the repair of the tissues around which prevent the shoulder from coming out give a very good results, and these things have specially been designed for athletes. So there is no restriction of activity after all these procedures.
So definitely we can advise the gentleman that he can go for surgery and get the best result. And as the things, because now there are tailor-made management.
Yes, definitely.
Yes. Okay, let's go to the next question.
Sure.
Hello.
Good evening, doctor.
Good evening.
I'm having daughter who is 12 years old.
10 years old.
12.
12. Yeah.
She is having shoulder pain in the month of June.
Yeah.
And now again she is having in September. And the pain is for at least 3 days. I had taken her to the specialist, and he said she must not carry her bag, school bag. So may I know, doctor, why that pain?
Actually, you yourself have answered this question because so to tell you very frankly, I also sometimes feel that our children carry bags so heavy that they are bound to give the problem.
Yes.
Though there are a lot of facilities available, so but second, I think again we are coming to ergonomics. The style, how I think you can address this issue, what she is, because you understood the question.
Yeah. Good evening. Firstly, see, in children especially, as doctor said, they are getting imposed with heavier burdens with carrying all those school bags and everything. So it's not, I mean, I don't know how possible it is to lighten those school bags, definitely. But
definitely in future will come with e-schools. That
yeah,
time I think
that
the things
will be better.
Yeah.
But as far as she is concerned, no, at that particular age,
Yeah.
there are a couple of things that can cause, pain in the shoulder in
yeah.
addition to this.
Yeah.
Okay. Sometimes what happens is a bit of calcium gets deposited in the muscles around the shoulder, or what happens is your shoulder joint is very complex. It not only consists of the arm, the scapular blade, but this joint in the front also.
Yeah.
So it's a very complex joint. Any problem in this and the movement leads to a problem with the shoulder.
Okay.
So we call that term as dyskinesia, abnormal movements.
Correct. Doctor, I'll just ask you a sub question. Just simple, because often children carry the bags on one shoulder, either mostly on the right or left. But suppose, because these are the days, sometimes they put that bag on the back. Is it more better or convenient because the weight will be balanced? I'm just asking you the question on her behalf. That's best. I think.
Yeah, people sometimes sling it like this and walk.
Yeah, correct. I think so. One option possible that she can try with that bag which is to be rested at the back, and that should give the better result, hopefully.
Definitely.
Chalo. Okay, doctor, I think we have another question. Hello.
Hello.
Yeah.
Yeah, I'm a 45-year-old lady.
Yeah.
Of late, for the past 3 or 4 months, one problem I've been having is that when I bend my left leg behind, when kneeling down position म्हणता पळय तशें, left leg, there is severe pain at the knee.
Yeah.
Otherwise, on walking, sitting, there is no other problem at all.
Yeah. But just as a विचारता कि what is your, why you have to kneel down? I'm just asking. Are you?
Any movement आता बसता न्ही, त्यांना suppose एक ते position.
म्हणजे I'm just asking. म्हणजे तुम्ही माने मोडून बसता तका म्हणता?
माने मोडून न्ही. Kneeling down position करता न्ही, पाय फाटल्यान घालता.
Yeah.
त्यांना हे जाता.
Okay.
And only left. Otherwise, walking, sitting, there is no problem at all.
Okay. एकच प्रश्न विचारतो. म्हणजे पेन जाता पण ते exactly फुडले साइडीक जाता, exactly at the, I mean knee joint.
Pardon?
Where exactly is the pain?
Knee joint.
Jointarच दुखता.
Jointar means both ways, फुडें आणि फाटल्यान.
अच्छा.
But like severe pain at that time only.
Yeah. अच्छा. Okay.
Yeah. Good evening. See, as I said, the knee is a joint that consists of 2 bones.
Yeah.
There is the bone on the top and the one below. Now they are separated by shock absorbers. Okay. These shock absorbers, transmit the weight from the upper bone to the lower bone. What happens is sometimes there is a tear in the shock absorber. These shock absorbers are called menisci. Okay. So any tear in the meniscus can lead to this problem, especially while bending the knee, kneeling down, they will have pain in the knee.
Yeah. Because she also mentioned it is kneeling down, especially when she puts her leg backside, she gets the pain.
Yeah. So from what she has told me, probably that is what it is causing her pain. But of course, she will require a better evaluation of what the exact pathology is. Now, if you talk about meniscus pain or any problem with the shock absorbers, there are treatment options available with us. Okay. Now, we can initially try with painkillers and with physiotherapy. A lot of times with physiotherapy, the pain decreases. But if the pain is not decreasing, nowadays we have new procedures. Like with arthroscopy, we can remove a part of the meniscus in which the part that is causing the problem is removed. But even newer is meniscal repair.
I see.
So earlier, what people realized is when they are removing the cushion as such, what is happening is arthritis is happening early. So nowadays techniques have come with which we can repair the meniscus.
Achha.
So again, it's all about preserving the joints.
Absolutely. So there are a lot of new things are happening. In fact, I'm glad that through media of this program, a lot of people are aware what are the newer modalities available. See, every time at least patients should know like what are the things available. All the time it may not be possible for them to go for it, and or it may not be needed. But we get a lot of questions, and I think that good message is going to the public. So thank you, doctor. Let's take a small break and we'll restart.